Yes.
Oh,
All dear medicos, myself, Dr. Deepak, DAMS ENT faculty, welcome you for this interactive session. And we are having the honor to have Dr. Niyati with us, marks 180 in FMG examination. So, beta, congrats for this big achievement.
thank you, sir. Thank you very much. It wouldn't be possible without you all, and I am not able to express it in words right now, but I am really, really grateful to the DAMS team.
So, beta, just use this platform to share your success journey, like which college you have passed and how was the experience with the DAMS family, beta?
Sir, I have passed from Russia, from Kursk State Medical University.
Okay.
And first, when I came back, I was really nervous and I was really skeptical that will I be able to pass or clear this FMG. And I was not even sure that I would be able to cross 150 or touch 150. But it was all due to DAMS team, my family, my mother, who have constantly supported me in this, and my brother, and everyone who has showered their blessings, and especially the DAMS faculty who have constantly motivated us. And sir, I would like to share that my first class with the DAMS batch was your class, and I really enjoyed the first class itself. And I, on that very first day, I thought that it is possible and I can do it, and I and it went very well.
So, beta, in the very first attempt, you managed to get this 180 marks. What was the strategy, beta? What was your strategy and how you proceed? Like coming to India back and then you join classes?
I just, when I joined DAMS, I was just focused on whatever you all told us, and it was all your strategy, and I would like to give all all the credit to you, and that's it. That's all I want to say. I just followed the schedule. I just followed the routine. Whatever you gave us, I followed the test. I followed the CBT. I followed the GT, and that's all what I did.
Great, beta. These are the great compliment for the whole DAMS family. Ke you follow each and everything very religiously. So let us start, beta. Like 19 subjects, how you handle any specific strategy or you followed to handle these 19 subjects? Because in the very first attempt, you're getting these marks. In the very first attempt, you are getting 180. It means somewhere, some smart learning you must have done.
Yes, sir, definitely. Like, first of all, I went through all the notes of the DAMS, and then later on, obviously, I attend all the DFX. And moreover, the PYQ session were the best, which helped me through. And the DFX sessions which I attend were like, they work like a magic. That's all I want to say. And the only magic was your strategy, and everything, that every small thing, and every single motivational speech, whatever you all the faculties have given us in class, they they really work like a magic, sir.
Thanks, Beta. Thanks for all these words. Now, one by one, I will ask you what was the role of workbooks you were getting on this in DAMS classroom? What was the role of those workbook in success journey?
Sir, I followed the workbooks religiously, and I didn't even see any other book except for the workbook for this time being. I am not saying that I was following it since my medical journey. I read some things during that period, but during this 6 months, I was religiously following these workbooks, and later on, when the DFX session started, I started reading from the DFX. But during that time also, there were some things that I used to recall it, that this was written in workbook, but I am not able to recall it properly. So I went back to the workbooks during that time, and at times I thought that I am doing much more, and it's going to be like. It's going to be overwhelming at a last moment to refer the workbooks again, and at times I thought that it is a mistake to go back to the workbooks right now, but it all worked well, and it after seeing the PYQ session, I just attained the confidence that
That's Great.
okay, I will be able to crack it.
That's great. What we are getting from Dr. Niyati rank marks 180 in the very first attempt. Okay, you should follow workbooks, you should follow DFX, you religiously and PYQ. These are the three
Yes.
basic things which we should follow for
And
that.
sir, CBTs were of great help. First CBT I gave it from the center. Second, I was not able to give from the center. But when I gave the first CBT from the center, I gained the confidence that how you should reach, at what time you should reach the center, how you should manage the time and everything. Because at home it's always it's always different when you give exams from home and when you give exams at the center. So my message for all the students is that please give CBT.
That's great. And I'm confident that everybody will take your words sincerely and they will not miss a single point which you're sharing here. Next point, Vida. This was your first attempt to appear for the FMG examination, paper 1, paper 2. Everybody was saying paper 2 was a little bit difficult.
Little bit difficult.
What was your experience with the surgery segment?
Sir, my experience was same as everyone said, that paper one I was able to crack easily, and I thought that okay, I will sail through and everything will be fine. But after paper two, I was a bit scared that it might go wrong in some ways, and then I started getting nervous. But at that time, my friends and my family said that it's a part of life. It's okay if you don't do, if you are not able to do in this attempt. And especially my mother, she was constantly supporting, saying that it's okay. And in the last few days of my preparations, I even asked my mother that like there were some tables in the books, and I used to tell my mother that I will tell you this, and you just
Yes,
check
ma'am.
that whether I am saying
Great.
it right or
That
not.
is a very good
Because she's a
manufacturer
teacher,
advice.
and she is really interested always that what am I studying. And that that was the experience I really wanted to share, because
That is very good
lots of
manufacturer
people
advice.
don't get that perks at home, and I had that. I had that.
So you convey our wishes to mother, your parents, your family because of who
Thank
you are here.
thank you, sir.
Any
Thank
special message, beta, any special message for those students who couldn't touch this 150 marks?
Sir, I only want to say that it's not the end of the world if you don't get it. Uh, Definitely, there might be some things which came in their path. There might be some hurdles. We all are not at a same pace in the first time or the second time also. And sometimes in the third or fourth time also, we get a little slow after failures. But it's not the end of the world, and we can always restart. That's all I want to say.
Thank you, beta. Thanks for coming on this platform, sharing your success journey. Again, I wish you
Thank
very best of luck for upcoming PG entrance exam. And like in this very first attempt, you got this 180 marks. I'm confident that you will crack the PG entrance exam with very flying.
Thank you, sir.
Best
Thank you.
wishes.
Thank you. Hope your
Best,
blessings work.
beta, best wishes.
Thank you. Thank you very much, sir.
Thank you, beta.